So in this video today, I'm going to be talking about what does it mean by 2 lines of improvement. This was a question that was asked in my office recently, and I thought this might make a really great video. Before I go into this, let's tell you how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, that's okay. Go to our website at visionforlifeworks.com. You can read a bunch of details on that page. You can look at some success stories. You can take a quiz, but you can also schedule a consultation. All right, now let's go back to talking about what does it mean by 2 lines of improvement. So let's just say that the initial starting visual acuity for the individual was 2200. On this chart, just based on the way that it works, it happens to be a large E, which on the big distance eye chart would typically be 2400 size. But if we had 2 lines of visual acuity improvement from, say, this large E at 2200, then that takes us down 2 lines to 2080. Let's just say the entering visual acuity is 2050, and we have 3 lines of visual acuity improvement. We've got 1, 2, 3. That takes us down to 2025. So when we talk about a 3-line improvement, 2-line improvement, 1-line improvement, this is exactly what we're talking about. 1 line on the visual acuity chart, which is also called a Snellen eye chart. And so this might be referenced in, say, a case of amblyopia where someone doesn't see as well with one eye. It may be referenced to whenever people have like improvement with their myopia and they're seeing better with lesser power in their glasses and they're going down the letter chart. And as a general rule of thumb for our office, if someone is amblyopic, we want to get to the point where we reach like something of what we would call is the point at which we're going to see more improvement. So it's almost like a loading point. And I liken it to someone maybe riding a roller coaster. When they get in the roller coaster and they're sitting in the little, scooter part or seat or chair, whatever that is, and they're going up in that train kind of up the hill, up, up, up. The loading part for us is getting to the point where you reach the top of the hill and you've gained so much momentum that you come down the hill super fast. And what that means is there's a loading point where we have to get and reach that momentum spot where we have some momentum behind us, just like down the hill on the roller coaster, that the eyesight will improve a line more rapidly at a time. And so for someone with amblyopia, once we reach that loading point kind of at the top of the hill, what we anticipate or want to see is about 1 line of visual acuity improvement for every month or 4 to 6 weeks. And that's a pretty big push, but that's generally where we're pushing our patients to be. And that might take a lot of work, so it might not be an easy thing to go through that, but that's typically what we're looking for. Now, myopia reduction is a little bit different, sort of, because we're still somewhat pushing for about a line of visual acuity improvement. Like if I lower the lens prescription and I say, by lowering your lens prescription, we dropped you back and your eyesight is not quite as clear and distinct. Maybe you're 20/50. But we would like to see that at least every couple of weeks to a month, that might be getting better. From now you're with the lower power, now you're seeing 20/40. With the lower power, now you're seeing 20/25. Okay, again, this eye chart is a little bit different than what is typical. There's usually some other lines in between here, but this is just a good reference point for you to understand what we're talking about when we say 1 line of visual acuity or 2 lines of visual acuity improvement. This is what we're really meaning. So now, if you like the video, certainly hit like. If you haven't done so already, make sure you subscribe so you get all of our videos. And if you feel like this is something that's really been worthwhile or beneficial that could potentially help someone else, please pass it on. Lastly, your call to action here may be that you need to schedule a consultation, or you might need to come into our clinic or give us a call. So if you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. And once again, you can do lots of things there, but if your next step is you need to just take action, then schedule a consultation to find out how we might be able to help you. Thank you.